What's up, YouTube? This is James coming back at you with another informative video. Hope everybody's doing good out there on this Tuesday. I'm doing real good myself. I come across this story right here and it is crazy. Look, these people are afraid. They're losing their minds and they're hanging on every word that their commander-in-chief says, so much to the point that they're dying behind it. They're losing their lives, okay? As you see right here, it says man dies, wife critical after ingesting additive to prevent COVID-19, doctor says. Okay. Now, Donald Trump, number one, is not a health physician. You know, he's not, and I don't think he has any experience in medicine. You know, or even to actually give advice on medicine. Okay. But this is mad. I'm telling you. You know, see, this is what happens, Mr. America, make America great again. All right, make America great again. Right. This is what becomes of that. Let's check this video out, and then we'll get into the story.
Gary and Wanda were best friends.
They were inseparable.
They were also scared about COVID-19. Wanda telling her friend Carrie Ann Monday morning,
"We thought we were going to get sick, so we took something.
Chloroquine phosphate. Similar but different than the prescription drug chloroquine, something they heard President Trump touting.
At my direction, the federal government is working to help obtain large quantities of chloroquine. We think it might work on this, based on very strong evidence.
That drug has been used to treat malaria.
It's a very powerful and useful drug.
The active ingredient also found in aquarium cleaner to kill algae. Wanda and Gary took that powdered version, chloroquine phosphate.
Every single medication has a side effect. And unfortunately, we predicted this.
Dr. Daniel Brooks is the head of Banner's Poison Center.
These medications have significant cardiac effects as well as affecting other organ systems.
Gary and Wanda tragically realized that too late.
They took us to the hospital and his heart stopped.
Since leaders started discussing the drug publicly, 3 people have overdosed in Nigeria. Sales and prices have soared online and misinformation has spread. A random man in Tempe posting a picture of the drug on Facebook, writing, "It can save your life." In Gary's case, it cost him his life.
It shows that a lot of scared people in this country are going to go to drastic measures that normally aren't their personality.
No one who's outside of an intensive care unit with a known diagnosis of COVID shouldn't be taking these medications. No one.
Now, as you guys can see, Gary and Wanda did a stupid thing. And we can look for more deaths to transpire behind this, because as you see, they said that this stuff is just flying off of the shelves, and they're basically saying that this stuff can cure or prevent COVID-19, aka coronavirus. All right, let's get into the story right here. Okay, this happened in Phoenix, Arizona. A man reportedly died after ingesting a substance used to clean fish tanks that contains chloroquine, a drug that President Donald Trump has claimed reportedly could be a game changer in the fight against the novel coronavirus. The man's wife is also in critical condition. The healthcare system Banner Health said in a statement, adding, within 30 minutes of ingestation, the couple experienced immediate effects requiring admittance to a nearby Banner Health hospital. The additive ingested had the same additive ingredient as the prescription drug chloroquine used to prevent and treat malaria, but it's formulated differently, according to Dr. Daniel Brooks, Banner Poison and Drug Information Center medical director. All right. Trump has been publicly touting chloroquine in the fight against the novel coronavirus, despite repeated warnings from health officials that any suggestion that it works is purely anecdotal. Okay? Given the uncertainty around COVID-19, we understand that people are trying to find new ways to prevent or treat this virus, but self-medicating is not the way to do so, Brooks said in a statement. The Center for Disease Control and Prevention advises on its website that there are no U.S. Food and Drug Administration (FDA) approved drugs specifically for the treatment of patients with COVID-19, and a vaccine is estimated to remain at least a year away. The CDC notes that a study in China reported that COVID-19 patients treated with chloroquine had clinical and virological benefits versus a comparison group, and chloroquine was added as a recommended antiviral for treatment of COVID-19 in China. Chloroquine or hydrochloroquine has been approved to treat and prevent malaria since 1944. Because this drug is on the market, doctors already can use it for off-label purposes. Trump has repeatedly taunted the prospect of the drug, although health officials say any suggestion that it could help is purely anecdotal. Anecdotal, yeah. And hasn't been backed by clinical trials. These people are desperate, man. They are desperate, The FDA said it advises against taking any form of chloroquine unless it has been prescribed by a doctor or obtained from a legitimate source. It says it's been working with online sites to remove dangerous items. Products marketed for veterinary use or for research only or otherwise not for human consumption have not been evaluated for safety and should never be used, according to an agency statement. FDA is aware that chloroquine is marked as an unapproved drug to treat external parasites in aquarium fish, but these products have not been evaluated by FDA to determine if they are safe, effective, properly manufactured, and adequately labeled. The agency said. Trump said he thinks that because chloroquine has worked well against malaria, he thinks it will work well against COVID-19. See, Trump don't know this. Trump, he's not a medical practitioner. I mean, medicine, he don't practice medicine. How would he know these things, See, listening to Mr. Make America Great Again, see? Gonna drive you in the dirt. It's gonna get you put in the dirt. But in conclusion, it says here, we don't know, but there's a real chance that it could have a tremendous impact. It would be a gift from God if that worked. That would be a big game changer. So we'll see, Trump said. When asked if the drug was promising last Friday, the government's top infectious disease expert, Dr. Anthony Fauci, standing next to Trump, said the answer is no, because the evidence you're talking about is anecdotal, whatever evidence. Yeah, anecdotal evidence. The information that you're referring to specifically is anecdotal. He added, I might not be pronouncing that word right, but be that as it may, it was not done in a controlled clinical trial, so you really can't make any definitive statements about it. Trump then stepped forward to add, we'll see, we're going to know soon. But Trump isn't alone in sharing enthusiasm for at least wanting to try the drug, especially on the sickest of patients who have no other options. New York Governor Andrew Cuomo says the state has acquired 70,000 doses of hydrochloroquine, 750,000 doses of chloroquine, and 10,000 doses of Zithromax, an antibiotic, to implement in drug trials starting Tuesday. Several clinical trials of hydrochloroquine for preventing or treating the virus are planned. The last thing that we want right now is to inundate our emergency departments with patients who believe they found a vague and risky solution that could potentially jeopardize their health, Brooks said. Yeah. Wow. Yeah, see. So we're going to hear about more stuff, like this, where people are going to be taking these crazy things, medicines, and going to get sick and probably die, other than, from the coronavirus, COVID-19, or what have you, based off of fear. Fear, wanting to live. You know what I'm saying? Wanting to live. See, when our great land was invaded so many years ago, our ancestors themselves were targeted. And there were biological warfare used on them. And what happened? These evil reprobates that violated this land here came here and gave our ancestors blankets that were coughed on, that had sicknesses and whooping cough and all that stuff, sick shit on it, and being that they had no they wasn't immune to that stuff because they didn't know sicknesses and shit like that. That shit got in the system and just killed them. Biological warfare, okay? So the whole adage is, what goes around comes around. And the word of the Most High say, you reap what you sow. All right? You shall reap what you sow. This is what we're looking at here in this country right now. That's what it's all about. See? But y'all tell me what y'all think about this story right here. I'm interested in hearing y'all thoughts, views, and opinions on it. Like, comment, share, and subscribe. This is James, and people, please remember to live your life as though we are being watched. Simply because we are, and I'm out. Peace.